Hey everybody, day 11. So I worked out on the floor um, my last shift, and I worked on a rehab floor that had actually been closed for 5 years in the hospital, and they are putting non tele patients there so they're not on the monitor. What I am saying is that they have COVID positive patients in with rural outpatients. In one of my groups, it was pretty, we didn't think this woman really had COVID. They're swabbing everybody that comes in. She was actually there for a stroke and no COVID symptoms at all, and was placed in a room with a COVID positive patient. These are large rooms that are set up for 4 patients that we have 6 in. So there's no curtains between each patient, so patient privacy is kind of out the window. There's no way that we can curtain off each patient, which is especially difficult for the alert patient, the awake patient, which is what I had out on the floor. Notice that certain supplies were hard to get. We did have pads out on this floor, but I had a patient that needed her ostomy changed, and after searching several floors, I could not find a system that had all the pieces. I had one piece of this size, one piece of that size, but none that could fit together where I could change it. So I wasn't able to change it. Um, but the patients I had were stable. Fortunate there. That floor, the patients are fairly stable, and I've said it before, but it's really the nurses out on the med surge and telemetry floor. I'm hearing more and more often from several different nurses that they walk into shift and they find one, possibly 2 patients that are deceased. It's a very high nurse patient ratio. It's patients that need to be more closely monitored, possibly in the ICU, and there's just not room, and so they put them out on the floors. A friend of mine was working. It was an area of the hospital similar to like long-term acute care. They had one normal patient there that had been at the hospital for 2 years, and they were using it as kind of a catch-all. One of the patients that I had extubated in ICU was was doing well and had been downgraded and was on this floor along with intubated, vented patients that need to really be in the ICU. She is an ICU trained nurse, so she was a big help out there. So, for example, they had a patient come in that really needed to be in the ICU, but there were no beds, so they were put out on this floor. Came up and began to desat. They were dropping their oxygen saturation down into the low 80s, high 70s. These are nurses that are not trained on how to ambu bag a patient that's on the ventilator. They aren't familiar with how to work the ventilator. Sometimes we can pop up the oxygen on it, but this patient was already 100%. And had my friend not been out there, this patient would have coded on the floor. So we're seeing that where, of course, where some of these patients that are on the floor on the ventilator that aren't being sedated properly are having a difficult time on the vent, and that does happen where they start to desat. They're fighting the vent because they're still awake. So just it's still dire here. It's we're still seeing things that are not typical. I don't know how I would react if I walked in and saw a patient that had already passed away alone. Um, no family, just nobody even aware that they were in distress, which is sad and scary. So we'll go in tonight and see where I am. They're trying to pull some of the ICU staff out onto the floors, and kind of weave them in and rotate them a little bit to try to get some relief to the nurses out on these floors. Trying to do some on-the-fly training. Of course, the drips that they can do out there are very limited, so again, it is almost impossible to keep the patient sedated and comfortable. And I'll report back on anything else that's going on. We are not able to get N95 masks every day. We are still wearing the same one for 5 days. I have been fortunate and had some sent to me, so I am able to rotate mine. So that is a tremendous help, because they say once they dry out for 72 hours, they can be used again. So if you have them to rotate, that really makes a difference, makes us feel a little bit safer. At this point, most of us feel like we have been exposed, and the ones of us that have not gotten sick, myself included, I kind of feel like I have the antibodies, and I'm immune. That's just how I feel. I could be wrong. I could be on here in a couple days saying, well, I'm in quarantine, but fingers crossed right now I'm doing good. Tired. So, but I'll keep you posted on what's happening here, and in the meantime, stay safe and stay at home.